As COVID-19 cases continued to spike across many parts of the country, it was pragmatic to enhance testing capacity for early diagnosis and facilitate timely treatment. Expanding testing facilities and infrastructure was one of the important actions in the battle against COVID-19. This video is part of Interaction Review of COVID-19 response in the state of Gujarat based on WHO's 10 strategic pillars of COVID-19 Joint Response Plan. Present video highlights strategies employed under Pillar 5, laboratory capacities and quality assurance in the state.
When we talk of lab capacities, but way back in February, BJ Medical College started functioning, and then slowly we had to ramp up the quantity of labs, and we also had to rope in the private labs. So now today we have as many as 87 labs if we include the private and the government facilities, and we're able to test more than 27,000 RT-PCR samples per day.
Testing was expanded to include the patients of SARI, that means severe acute respiratory tract infections, people who were going for operative surgeries. So pre-op testing was also incorporated for COVID-19 testing so that healthcare professionals can be provided a protective environment. ANC mothers, so that if there is no transmission from mother to child, but if at all it happens, we are alarmed. Criteria expanded from very few selected cases to a large spectrum of population. Slowly, antigen testing was made available, and since it's a point of care test, it does not require stringent infrastructure and skilled manpower. This was also incorporated for testing in certain areas like hotspots, containment zones, in certain cases at patients' bedside also.
We also had to pay a lot of attention to quality, so the NABL accreditation as a precondition that ICMR keeps for giving permission to the labs was also being adhered to.
Development of standardized guidelines, be it collection or transport or even testing SOPs, troubleshooting SOPs, quality assurance SOPs, standardized document development also seen as a challenge. It worked on all aspects of the resource availability, creation of pool of technical manpower.
Get more and more technicians into these labs and also train them and mentor them real time. Often these teams had to work literally 3 shifts a day, and we had to keep their motivation levels also high, for which we started mentoring of all these labs by a senior microbiology team, and we also had a WhatsApp group where we would literally on a daily basis interact with them.
Gujarat has taken prompt action to facilitate increase in laboratory capacity and quality assurance. Prompt expansion of testing capacities, introduced universal testing by making antigen testing availability at various places, mobilizing and building capacity of human resource, mentoring of human resources, engaging private sector labs. This video is prepared by Indian Institute of Public Health Gandhinagar with support from the World Health Organization. We thank Department of Health and Family Welfare, Government of Gujarat for their support and cooperation.